4 tips any dentist can use to reactivate lost patients. He had it all: a $2 million a day salary, a $7 million California mansion, women, fame, good looks, and yet now the dude is in the gutter, making a fool of himself each and every time he appears on TV. In fact, I just picked up a copy of People magazine which had a cover story saying, "What happened to Charlie Sheen?" Now, I'm no mental health expert, but it sure appears Charlie needs some help, and he needs it fast, before his world crumbles like a California earthquake. In any event, all this tabloid hoopla got me thinking about reactivating lost patients and what a sober Charlie Sheen would do. Tip number 1, don't give up. Too many dentists throw in the towel when they haven't heard from or seen a patient in some time, which is a big mistake. I know a dentist who mails letters to patients he hasn't seen in 5 years. Wowzer. Say what you want about Charlie Sheen, but the guy is no quitter. Tip number 2, pour your heart out. Want to reactivate lost patients? Then simply send them a letter telling them you sincerely miss them, and let your heart do the talking. Kind of like Charlie Sheen does, without the wild rants. Tip number 3, be consistent. Running a lost patient campaign once in a while ain't going to do the trick. Set a goal to run at least 4 a year, and shoot for a reasonable goal of, say, a 1% response. Numbers like this will put you in the money plenty. Needless to say, Charlie's big problem is consistency. Once a year, he's on the straight and narrow, and the next, he's lying face first in a puddle of mud. Tip number 4, take action. The next step, and often the most difficult, is to get going and do something. Indeed, once you get started, your momentum builds, which causes you to do more and more. In fact, if there's any secret to running a successful lost patient campaign, it is simply taking action. Sure, your first couple of letters may not be the best. Then again, give yourself some time, and you'll soon turn into a marketing machine.